Hi friends, welcome back to my channel Sharing Simple Knowledge. Today I am here to give an overview about Osce examination for NMC registration. So you have to do 10 stations in that exam. The first one is assessment, next one is planning, then implementation and evaluation. So that are 4 stations you have to do. So the assessment will get a scenario, then you have to do the assessment of airway, breathing, circulation, disability and exposure, including holistic assessment. That means the physical, psychosocial and spiritual and sexual assessment. So then the next is a planning station. This assessment is a 20-minute station. Then planning station is that you have to prioritize 2 needs of the patient and you have to make a care plan for that one. That is a 14-minute station. Then next comes the implementation station. That is the administration of oral medications for the patient. But you have to, this is a 15-minute station and you have to be careful if the patient is allergic to some medication, and if it is prescribed, you should not give that medication, and you should check the prescription carefully for the completeness. Is it legible and is it valid? Is it due today? If sometimes they will prescribe the medication but the start time date will be tomorrow. So we have to be vigilant when we are reading the prescription. Then the last comes the evaluation station. That is 8-minute station. That means the handover station. So if you are transferring a patient to another ward, or if your duty finished and you are endorsing to someone else, that comes under this evaluation station. So this is mandatory for all the candidates, and out of 10, these are the 4 stations. Then next, there are 22 skill stations, but you should not, you don't want to perform these 22 stations. So out of 22, you will get only 4 stations. That then from the assessment, planning, implementation and evaluation plus these 4 skills, it came 8. It become 8. And then we will get the professional values, that is a writing skill, and next is evidence-based practice, that also writing station. So total 10 station you will get. I think it's clear for you. Then let's move on to the 22 clinical skill stations. What are they? The first one is administration of inhaler medication, that is like pentolin puff we have to administer, that is a station. Then next is administration of suppository, glycerin suppository. Then next is aseptic non-touch technique, that is the performance of wound dressing. So prior to that, the wound assessment, there is a station, so it will come together. The wound assessment is 6-minute station and the aseptic non-touch technique is 15 minutes, so total 21 minutes you have to perform. Then next is blood glucose monitoring. We have to check the blood glucose. Then bowel assessment, that is a stool chart they will give, Bristol stool chart. Then according to that, whether the patient is constipated or he has diarrhea, we have to document, and what are the advice we will give to the patient. Like that we have to, that is a writing station. Then catheter specimen urine sample collection. Next is nasogastric tube insertion. Then another one is fluid balance, that also writing station. They will give the intake and output, then you have to calculate and make sure whether it is a fluid, the balance, is it positive or negative, like that. Then next comes the in-hospital resuscitation, that is the BLS. Then intramuscular injection, subcutaneous injection, then midstream specimen urine collection and the analysis. Then nasopharyngeal suctioning. Then nutritional assessment, that is the master malnutritional universal screening tool, that also we have to calculate, that is writing station. Then we have to verbalize what are the treatment we will give, what are the surgery recommendation for that, what is the cause for this malnutrition, and what are the remedies we will take, like that. Then oral care plan, that also they will provide some scenario. Some it will come like end of life care for cancer patient, or some with cerebral palsy like learning disability, then critical care, ICU patients like that. Accordingly, we have to write which type of oral care we will provide to that patient. So that is a writing station. Next is oxygen therapy administration. So we will get the reservoir mask and how we will apply the oxygen, the supplemental oxygen for the patient. Next is pain assessment. That is, we are just verbalizing only. We will assess the pain. We will ask the patient if he has pain or where is the pain, like is it radiating, then what is the score, like that. So that is, we are just asking the patient and we will verbalize that only. Then peak expiratory flow rate, if you have to demonstrate and have the patient to do it. Then pressure area assessment, then that is includes the Braden scale tool. So we will get a scenario, then accordingly we have to calculate the Braden score. Then we have to write which are the the vulnerable pressure areas. So we have to write those areas like head, sacrum, like the prioritize. Then what are the signs, symptoms of pressure sore. We have to write it. Then next comes the removal of urinary catheter. Then wound assessment I told you. Then subcutaneous injection also. So these are the 22 skill stations. Out of that only 4 you have to do. Then next comes the professional values. This is a writing station, so we have to study the marking criteria well. Then if you miss any point, you will fail in this exam. So you will not get only one scenario they will give. Then accordingly we should differentiate which is the scenario and which is professional value is this. Then we have to write it. So it comes like bullying, concealment of bed status, confidentiality, drug error, false representation, falsifying observations, falsifying timesheets. Then comes the hospital food, then impaired performance, laboratory results, possible abuse, professional confrontation, racism, social media, and witnessed abuse. So these are the professional values. Total 15 are there, but only one you will have to do in the exam. Then next comes the evidence-based practice. Now currently they provided 14 only, and there is one obesity, but the marking criteria is not yet out. So only 14 now we have to practice. There ankle sprain. Here they will give some scenario and article summary. Some research show that, like that, some evidence they are providing. So we can get the points from that one also and just write some point from the marking criteria. At least one sometimes it's missing, so we have to we should know the marking criteria well. Okay, so these are the one: ankle sprain, autism spectrum disorder, bedside handover, cervical screening, cranberry juice and urinary tract infections, dementia and music, diabetes, female myocardial infarction, fever in children, pressure ulcer prevention, restraint, saline versus tap water, smoking cessation, use of honey dressing for venous leg ulcers. So these are the evidence-based practice. I think you got an idea regarding the Osce for NMC registration. So if you require further information, just comment below the comment box. Thank you for supporting my channel. Keep watching. Thank you.